This doesn't have to be some big elaborate thing and nothing, then you just kind of explain to me of what some of this stuff is for.
Right here's your responder bag, blood infection control kit. Any blood items or whatever. You have your bags in here, you have your sprinkle stuff, you have your mask and gloves.
Okay.
Right here,
This is predominantly for blood?
it
That's
could be
the kind of body
blood.
fluid you're gonna
Oh,
do
it
in
could
or
be
urine or?
Yeah, it could be urine, it could be throw up, it could be whatever, whatever is bodily fluid.
Okay. And
Okay?
so what's in here is like protective gloves and cleanup
Yeah,
materials. for
mostly,
getting them off
yep. Here is your gauzes. You have a variety of sizes per injury.
Okay.
You don't know what size it is. You have gauzes of all kinds. And multiple amounts.
Oh, okay.
And each one is individually marked trauma compress,
Oh, okay.
sterile gauzes, blood stoppers, soft roll gauze for wrapping an injury up. After you've gauzed it over, you can wrap it up with either one of these.
Oh, okay.
Okay? Cold spray. Oh, and here's some more gauze pads that go with the same branch.
Okay.
And you'll have your eye pads,
Okay.
in case of an eye injury, same thing for gauze. When you're using eye pads, a lot of people don't know this. Use both of them. Most people think an injured eye, you just are covering that eye, wouldn't you?
Right.
Cover both.
Really?
The reason is it keeps your person that was injured, you're always blinking
Right.
with your eyes open. It's better to cover both and help escort the guy to a vehicle.
Okay.
If it's bad enough that you're gonna need eye pads.
Hospital, yeah, okay.
Put one here and one here. That keeps the eyes, go like put your hands over your eyes and you'll notice. It keeps your eyes from moving, your eyelids.
Yeah, it's better.
And if you move with one hand off, you'll notice the other eyelid starts twitching.
Right, you get that, all that.
Yeah.
Weirdo
and
stuff
and
going
if you
on.
have a piece of metal, glass, shrapnel, or whatever in your eye, it's gonna tear that eye up with you
Yeah.
moving it back and forth.
Yeah.
But put two of them on. That's why there's two in here.
Okay.
You put two on, tape it on, and then help escort the guy there.
Okay.
I'm not saying if you have to use an eye wash and just a little dirt or dust in your eye. Oh, gotta put an eye pad on you. No. But if you get a serious eye injury.
Oh, okay.
Here is a disposable blanket. These blankets are waterproof. These blankets are what they use in emergency and ambulances. You know, pretty self-explanatory. Somebody's injured, you gotta cover them over until you get somebody help.
Sure, yeah.
There you go. Ice packs. They're for, reduce swelling. Somebody pops a finger, open it up, tape them on, help relax. You know what I mean? Breaks the bone.
Okay, got it.
Okay, now we're gonna go and I'm gonna put all the tapes here for you. There's different kinds of tapes in everything we do. The glass goes over there. Okay, with these tapes, this is a waterproof, pretty heavy duty, sticky tape. It has 3 sizes in there.
Okay.
You get a wound, it'll really stick to it.
All right.
These two are Cobain wraps. They actually, you can wrap up somebody's wrist, keep it pretty and solid. If you've ever had a sprained wrist at the hospital, and they give you that stuff, and they use the vets use them, where you can still stretch it. This doesn't stick to the wound at all.
Okay.
It won't stick to anything but itself. So that's what these are for. These here are ACE stretch Band-Aids. Just like when you sprained your ankle
Yeah.
in football or whatever, they have the clips on them.
Okay.
Wrap them tight and clip them.
Okay.
Now, we're going back to gauzes because I've spaced out. This is a triangular bandage. You can make an arm splint if you need to,
Okay.
or a sling. You can also use them for a wound if you have to. But mostly they're for slings.
Oh, okay.
Okay, now let's go. I don't recommend this, but they put them in there anyway. These are ammonia inhalants. And the reason why I don't like them, but it's up to you, is say you're up on this table, you fall over, bang your head. You're unconscious, but you fractured your neck or a piece of your back. The moment somebody puts an ammonia inhalant under your nose, you stood. You don't even know, but you're gonna have a convulsion, basically. Well, if your neck has a fracture in it,
You can do
what's gonna
insult
happen?
to injury there.
You're gonna hurt it even more.
Yeah.
I don't like them, but they put them in there, so it's whatever
It's
you
to bring
wanna
somebody
do.
around if they're unconscious.
Yeah,
and you-
but if they're unconscious, you should be slapping them.
You should
Hey,
try to
buddy,
get
are you
them.
all right? Call 911. Call
Yeah.
911.
Right.
Hello, are you okay, bud?
Okay.
That's why your first aid class always tells you, slap them,
Yeah.
call somebody, yell 911. You know, that way you're not moving a patient that might, if he's unconscious, he can't tell you what's going on.
Yeah. You might sustain more injuries.
Right here are large varieties of Band-Aids, because sometimes you'll run out there and all he needs is a Band-Aid. You know,
Yep.
it happens.
Okay, it's all right.
You know, you have different kinds. You have the shear,
Yeah.
which are vinyl. They don't stick to the skin as much, especially with older people. If you're doing older people and you put a Band-Aid like those fabric on that just don't come off very easy, it'll rip their skin.
Oh, yeah, I don't
The
want
vinyl is very light and easy, or if a child or whatever. You have extra large and, you know, regular.
that. Okay.
Here's your CPR mask. On here it has an oxygen port. You know, up here, if you have the bag that goes, which I don't know if you do or not, but you can slip it on here,
Okay.
put it on the guy's mouth, go 1, 2, 3, or you can blow through this.
Oh, okay.
I hate opening it, so I'm not going to.
No, no,
but
that's fine.
inside, you will see a mouthpiece. You see that mouthpiece inside there?
Yep.
That's fit for your mouth. It will fit right in here.
Oh, really?
And if
Okay.
the guy pukes, which I've had happen to me, it won't come back in your face.
Oh, okay.
It has a two-way valve.
Got it.
Yeah, in, no out. In, no out.
I
The
got
guy can breathe here. Plus, if you have to, you can put a nice seal if you feel it. We'll
Oh,
seal
yeah,
on its
it's
face.
still there, yeah.
You know, now if you need to have oxygen, or say you have that strapped on somebody and you're doing CPR and the ambulance comes. Man, we gotta get oxygen on him. All they do is pop the red cap, oxygen fits right on there and he's on oxygen.
Okay, cool.
Okay?
Excellent.
Any other questions so far on all this stuff?
No, I don't think so.
Pretty much is pretty simple.
Yeah.
Here are some surgical scissors.
Scissors.
Here's a couple more little tapes. These are waterproof adhesive like the green one.
Okay.
But they're in a smaller level, so if you have to use a whole roll real quick, you got it.
Okay.
Okay? Here's your 3-in-1 Neosporin.
Okay.
You know, that's back to where if you have a little cut or something. Here's some alcohol wipes, a full box of them, in case you have to do a clean wipe. Here's a first aid book.
Yeah.
Most of the time, if something serious is happening, you're not gonna read it, but you might.
You might.
So you have it here,
Yeah, it's nice to have it in case you did.
and
A light.
a light, in case you have to look in there, or people say, oh, for the eyeballs. No.
Obstruction.
You can look in for obstruction,
Okay.
you know? You can look in their eyes, you can look in here, you can look at the ears.
Yeah.
I had a guy run a piece of rebar in his ear once. Didn't go all the way where it killed him, but it blew the eardrum. But when he pulled it out, you can look inside and make sure there's nothing.
Yeah.
Now, if something happens like that, try not to remove it. Let the doctors remove it.
Yeah.
But this guy had one of his co-workers do it, remove it. Just pull it out, it hurts too much. Well, now you don't know what's left in there.
Right.
So this is what this little light's good for,
Oh, that's cool.
you know? And little burn gel.
Okay.
If you need more than that, then, you know, you need to, you have the big packs in your first aid kit. Right? This isn't here to create surgery conditions.
No.
This is here to make sure that whoever is here injured is took care of properly.
Yeah.
And made until 911 or somebody comes.
Exactly.
And then QR, you know what that is, that's a wound seal.
No, I don't know what that is. That's what
You have it in your first aid kit.
Okay.
And this is, most of you guys probably don't know what that is.
we don't.
Okay, I had a guy cut his hand from here to here. And with that, they couldn't get the gauze to stop bleeding, it kept dripping. Little packs of that, yours are bigger in your first aid kit, but they're about this long. Sprinkled it on there, stopped it like that.
Okay.
I have people call me that are on blood thinners. It's the only thing they get to stop the bleeding.
Mhm.
Now here's a major thing, if you have to use that on somebody, and he goes to the doctor, a lot of the doctors don't know hydrogen peroxide dissolves it.
Oh, okay.
It doesn't enter your bloodstream, it just clots real quick, boom. But most doctors go, oh yeah, especially the young ones. Older ones all know, but if you get a young intern, I don't know, so they'll try either picking it out of there, which hurts even more than putting it on.
Oh, yeah, I bet.
But if you use hydrogen peroxide, it just dissolves itself.
Okay.
Okay, and then we have,
What is this thing called?
it's called wound seal.
And then was a chemical name you named, you called it some kind of chemical name. GH or something?
Yeah, urgent care, not urgent care, but what was it? It was urgent care,
Oh, okay.
yeah. And all it is, that's what it used to be called, and they were bought out.
Oh, it was a brand name
Yeah.
previously. No, I got you.
So wound seal bought them out. I said, nope,
That's for profuse bleeding that you
Yeah.
just cannot control. And
yeah. Or just even some little nick. You're not gonna, nowadays, you don't know who's diabetic.
Mhm.
So you should have sharp containers, hopefully, in case somebody uses their needles. You know, put someplace, or blades, or whatever.
Right.
You also don't know who's on blood thinners anymore. You could be 28 years old and they got them on cumin.
True, true.
This stuff will help with the blood thinning stopping if it just gets a little nip.
Mhm.
I can't get the Band-Aid to stop bleeding, stop it. Sprinkle it. Sting and hurt, yeah, but it will stop the bleeding.
Yeah, well, yeah.
Or if you get major cuts, then you use the big packs you have.
And then, so this is for like if you're
Eye or skin, you can use it for, say,
flushing solution?
yeah, say you got somebody injured and you have to flush the wound. You can use
Okay.
it there.
Right.
Say there's something in his eyes and you can flush that with his eyes.
Oh, okay, this is purified water and sterile.
It's buffered water,
Okay,
so what
got
it
it.
is. Yep.
All right, and then this is more
And then
gloves.
gloves, yep.
Okay, cool.
Pretty simple.
Oh, yeah.
Okay, if you can hand me that